Hi everyone, my name is Coach Carin Roberts and I own Live Out Loud Wellness, and I am a metabolic genetic health coach. But I wanted to come on today to teach you what is your metabolism. So what does a metabolic genetic health coach do, right? So your metabolism is how the cells in your body create and use energy. Our cells need to be optimally powered to create good energy. And some of you may have heard of the new book out, which I'm obsessed with, called Good Energy by Dr. Casey Means. And I'm obsessed with this new book that came out called Good Energy by Dr. Casey Means, because it really breaks things down into manageable steps about what our metabolism is. And I have been health coaching people for over 16 years metabolically, and I just wanted you, I know we all go to the doctor and sometimes your doctor says, well, that's okay, you gain 10 pounds, that's because your metabolism is going down. So your metabolism is your energy, and your energy is your life. So yes, basically your doctor is saying you're dying, we're all dying, right? But if you can get yourself in the driver's seat on how quickly this process takes place, that's really the key, your quality of life, right? We want to focus on our health span, not just our lifespan. We already know they're going to keep us alive till we're 100, but we want quality of life, right? Quality of years to spend with people we love, and that equates to energy. So that's what metabolism is. It's how much energy you have to give your life, and bottom line. So now what I want to break up into is a lot of people have heard of metabolic syndrome. The other thing that has been thrown out there this year is that 96% of Americans are metabolically challenged. So what does that mean? Again, going back to metabolism, most of us get a yearly blood test, and I just wanted to educate you on the 5 markers on your blood test that have to do with your metabolic health that they look at when they're talking about metabolic syndrome, or it's also called Syndrome X, okay? And because I know a lot of you are going to your doctors and getting your yearly test done, crossing your fingers, hoping, praying that it all comes back okay, even though you might not feel so good here, so good there, and some things have changed, but pray those numbers come back, right? But do you really know what that blood test means? Do you know how to look at it and see if you're truly healthy? Because I'm going to tell you the 5 metabolic genetic markers, but then there's what doctors consider normal, and that's as soon as something gets to the range that's not normal, it's going to be red, and they're going to prescribe you a pharmaceutical to get it in check, because that's all they know how to do. Doctors practice medicine, right? So when we're taking a more holistic approach, we really have what we call optimal levels, okay? And that's where we really want things to be. We want to be functioning on that high level, which means high metabolism means high energy, okay? So I'm going to talk about what those 5 markers are. The first marker is your triglycerides. This is part of your cholesterol panel that's done, but a lot of people are only looking at their LDL. Your triglycerides have to do with sugar and alcohol, and they are going to tell you that a normal marker for your triglycerides is 150 or less. But where I want my clients to be optimally is under 80, and preferably between 50 and 60. So the second metabolic marker of metabolic syndrome is going to be your HDL, another marker of your cholesterol. And a lot of people nickname this good cholesterol, and that is because HDL, your high density lipoprotein, is going to eat up the bad cholesterol in your blood. So we want this number to be high. So an optimal number should be over 50 for your HDL. Actually, a normal number of good cholesterol would be over 50. Optimal is between 50 and 90, okay? The third factor of metabolic syndrome that I want to talk about is called fasting blood glucose. So this is when we eat a carbohydrate, anytime we put food in our mouth, our glucose goes up, our insulin goes up, but it's all about how quickly our insulin and glucose come down after a meal. That tells us whether we're metabolically challenged or not. So they're looking for your fasting blood glucose to be under 100. Once you hit 100, now you're in the red zone and they're gonna say you're pre-diabetic. But what I'm going to tell you is optimally, your fasting blood glucose should be between 70 and 85. By the time you hit 100, you are in metabolic syndrome, and it's just going to be a cascade of other things going downhill from there. So we really want to keep our glucose in check. And also, you might want to find a fasting blood glucose monitor. You're going to see these all over the internet. I know they used to be looked at just for people who have diabetes, but we really need to understand our bodies better. So I look at it as like the best wearable ever, because I can see how a meal affects my body, and I can see how fast my glucose comes down. And even with lifestyle factors, like if you didn't sleep well, right? Where your fasting blood glucose looks like in the morning after a night of bad sleep, poor sleep, right? Or after a night of being out late, things like that. After you might have had a day that you weren't eating the way that you wanted to, right? That could affect the whole next day or the next week. The fourth thing that I want you to look at on your CBC test is your blood pressure. Your blood pressure should be, a normal blood pressure is 120/80. And your blood pressure is directly related to insulin resistance. So one of insulin's many functions is to stimulate nitric oxide, and that's a chemical that dilates blood vessels. So a lot of people who have insulin resistance also have high blood pressure. They go hand in hand. And the last thing is your waist circumference, okay? Your waist circumference, I know we measure a lot of places on our bodies when we're on a health journey, but really all I care about is what that waist circumference is. That's a marker of fat that's in and around your abdominal organs. So we don't want our abdominal organs to be crowded with fat. And that fat is just excess energy that's being stored there around your midsection belly fat. And that is one of the places that starts to expand when we start to get unhealthy. So those are your 5, and I just want to say with that waist circumference, they say normal for men is a 40-inch waist to be metabolically healthy, 35 inches for women. Optimally, we say men should have a 35-inch waist to be optimal, and a woman no more than 31.5 inches. And that's according to the International Diabetes Foundation. So I hope this really helps you understand what your metabolic health is. And I found as a metabolic health coach that if we're going toward improving your metabolism and your blood test numbers, instead of focusing on weight loss and the scale, that what you're really looking for is to feel good in your clothes, to have more energy, and to truly be healthy and live the quality of life you want to live. And that way you'll never feel like you have to get up in the morning and get on the scale in the first place. And that's my goal for you, but I'm excited to hear about what your goals are for yourself. And you might want to look at the metabolic genetic test that I offer that could be a good intro into your journey, and because we get a lot of great information from that as well to marry with your blood test and to marry with your health history on what's expressing, so we can take this journey together in an empowered way. I'm so excited to support you in finding your passion and purpose in life and to live out loud.